As value-based care is becoming more popular in healthcare, it's really important that your patients have a patient-centered care plan. In this video, we'll talk about why it's important and what the benefits are to both the patient and the provider of doing a patient-centered care plan. Hi everyone, this is Dan from ThoroughCare. At ThoroughCare, we're most known for our patient-centered care plans in our software, so we wanted to share why we feel it's important to both the patient and the provider. If you're not sure what a patient-centered care plan is, be sure to check out our other video in this series on what is a patient-centered care plan. But in this video, we'll specifically talk about the benefits to both the provider and the patient. So let's start with the three major benefits to patients. First, the patients receive an improved patient experience. Let's face it, everyone's different and there's not a one-size-fits-all care plan. It should be tailored to things that the doctor feels are important, but also the patient feels are important. Each patient is unique with their own individual needs. So when their care plan is designed just for them, the patient really feels enabled to follow through with it. The care manager will typically ask, what things are important to you? So from then on, the patient is immediately bought in and will be more determined than ever to focus on those goals or resolve those barriers because they really understand what the health outcomes will be. This collaborative approach to the care plan is really designed to improve the patient's care over time. Each month, we want to show improvement on the care plan. The second result will be higher patient engagement. When the patient is fully bought in to the items in their care plan, they are more inclined to follow through with it. This results in overall engagement, overall patient satisfaction. It's really a win-win. However, if the patient were just given a list of things to work on and they weren't fully bought in, that patient engagement, as you can imagine, would be much lower. Finally, patients will benefit from improved health outcomes. When they work on the items in their care plan, the end result is improved health, satisfied patients, fewer trips to the doctor, or the less likelihood of being admitted to the hospital. For most patients, they can stay healthy at home. Patients feel more comfortable when they're at home, and avoiding the risk of going to a home or a facility or even the emergency room can really be a motivator for the patient. The patients aren't the only ones who win here. The provider and their staff get a lot of benefits out of this too. Let's talk about three important benefits that the provider can expect to receive with patient-centered care plans. First and foremost, increased patient satisfaction. As providers try to improve their satisfaction scores, patients that are engaged with their care team and provider are more satisfied with their overall care. This is one benefit that providers will receive immediately after putting the patient through a patient-centered care plan. Also, patients may rate their practice or leave a review online. A satisfied patient leaving a positive review goes a long way in the reputation of that provider. Secondly, it improves employee morale. Your employees often get phone calls from angry patients or frustrated patients, but typically, patients that have a patient-centered care plan are fully bought into their care and know what to expect out of your staff. When those patients engage with your staff, the encounters are much better. They're happy, they know that you are looking out for them, and those conversations go a long way to keeping your staff happy. Finally, doing a proper patient-centered care plan can lead to increased revenue for the practice. Not only will you see efficiency savings and time savings, but a lot of these programs can be billed for. For example, you can bill chronic care management for the time you spend reviewing the care plan with the patient each month. You can also improve your quality score through programs like MIPS. Linking items in your care plan to quality measures that are important to your practice is a great way to kill two birds with one stone. You'll improve the overall quality of the office, possibly get reimbursed through it through programs like CCM, and keep your patients happier in the process. So as you can see, switching to a patient-centered care model not only improves your patient's life, but also improves your practice as well. Providers, employees, other people in the practice, even the patient's family members as well, all become part of the care team as well. So now that you know the benefits of a patient-centered care plan, you may want to dive in deeper. So check out some of the articles in the links below so that you can learn more if you'd like. If you found this video was helpful, please be sure to like it below, and we'll also welcome any of your comments. This is Dan from ThoroughCare. Thanks.